Welcome, Houston, to Chai Time on 103.5 Hum FM. We're so excited to be here this Monday morning. We have an amazing topic. It's community health clinics. We have never spoken about this before, and we have our dear guest, Mahtab. She's the Director of Behavioral Health Services at Ibn Sina. And with her, we have Sonia Keshwani, licensed community health worker. And we are so thrilled that y'all are there to share this with us so the listeners can use it and make more of it, right? So what have you learned since becoming a community health worker?
I think the biggest thing is advocating for the patient, speaking up where needed, getting people the help they need through accessibility, affordability, and just having that transition, lessening the bridge.
Right, between the
patients and medical services or even behavioral health services. A lot of people, they don't come to even get a regular checkup because they can't afford it, they don't know where it is, how to get there, transportation issues.
Right.
So we want to lessen those bridges.
Oh, wow, that's amazing.
It's great to have, so the community health worker model really puts that emphasis on prevention.
Okay.
And so being able to empower the patient through education.
Okay.
So the more we know about our health, the better choices we would make. So our CHW team, which Sonia leads, and she's helped train many get their 1,000 hours, and it's just, she's been such a blessing to us. They help the patient navigate. So, okay, now that you do have a high score on an assessment that measures anxiety or depression, what do you do with it? So oftentimes her team is the patient's first, greeting in terms of mental health.
Okay.
And then we're kind of in the background, but they do the assessment, the patient navigation, sometimes the care calls. Sometimes patients, they realize that they have issues, but maybe there's stigma, maybe there's religious reasons, maybe there's someone in the family that doesn't want everyone else to know the secret, so they are deterring them from getting the help that they need.
Okay.
And so they see all of it. They see that the patient at their highest level of distress, when they're overwhelmed. And so that's really critical. And it takes a very special person. And I really think that Sonia has all those attributes. I call her the other half of my brain. I text her everything I'm supposed to remember and do. I'm like, just in case the other half is not responding.
But it takes a good supportive leadership team, and Mahtab really does a great way of supporting everyone from the therapist to the CHWs to our volunteers and the medical team.
That is amazing. I mean, I just see the relationship y'all have, right? And I mean, just the energy and the passion that y'all talk with, right? So that means a lot. I mean, I know I would be in safe hands if I. And so I was talking about it. How, so when you enter, let's go with what is a community health clinic, right? Because it's, it's there, but it's not spoken about much. And we're talking about Ibn Sina because you all work there. So let's start with that.
So we have medical, we have specialties, children and dental services. So if you come in as a medical patient, you would check in, the medical assistant would take your vitals, then my coworker, I would come in. We would do the screening with you, and the screening is for depression, anxiety, and substance abuse. If it's a high score or suicidal ideation, then we get the patient a consultation with the therapist. We also let the nurse practitioner know, and then you can decide your course of treatment. If you don't want therapy or psychiatry, you could just work with the nurse practitioner. They're all trained in this. But just lessening that bridge, and the consultation with the therapist is free. So it's only for your benefit,
right? And I mean that's what we were talking about, is that when you go, or when I go to my doctor's office, There is no, it's just a paper, right? And I
Yes.
mean, I can answer whatever I want on
Yes.
there. But that actually a person, qualified person comes in to do that with you. I think that's like impressive. That's already a step ahead, right?
And to reduce that stigma, having that self-awareness is also important. If I know something's bothering me and there is a resource that can help me,
Yes.
then it's better in
Yeah.
the long run for myself and my loved ones.
Yes, absolutely.
I think that's one of the, myths about community clinics is that somehow they're, not fancy enough or not
Yes.
qualified, but it's actually the opposite.
That's what I'm thinking in my
Yes.
head, right? Like, I mean, I don't know, because I do have insurance, so I'm not going to go to a community health clinic, but it almost sounds better, now. So now I want to step in and actually see.
Just don't come on a Saturday. No.
But
We have so many governesses. Like we have a lot of institutions kind of implementing best practices. We couldn't even go near a patient until everybody had 80 hours of training.
Okay.
All our nurse practitioners had to take the same training before they could be serving our patients.
Yeah.
And those don't stop, because when you have more funding from like either government or local, they expect everybody to, their education, their CEU hours. Like Sonia has a master's degree, and she's done, the Rice University line program. She's way overqualified to just ask, how's your day going, or are you feeling depressed? But we actually want that. We want somebody who understands the role so much that the patient, because that patient may never get to me or a clinician, but at least we did everything we absolutely could for them during just a visit for, I don't know, their thyroid medication.
Yeah.
We actually, we want to reach as many people as we can. And I think, how many thousands of people have
Over 10,000.
Oh.
Yeah, they have screened over 10,000 patients just in that one
great.
clinic.
Yeah, that is just great. I mean, we are taking steps for mental health. I think that's a big achievement, right?
Yeah.
Because especially in our community, it's such a big stigma. So just taking these steps help with that.
Yeah, and taking the time, I think, sometimes Sonia will go with like Urdu speaking, Hannah will go talk to the patients in Spanish, and we feel heard. Some of the patients we get, they're not used to someone caring about them this much.
Oh my gosh, I have like goosebumps. Yeah,
so
that's
they're
amazing.
very, you know me, I'm very like, I don't give out compliments.
Yeah.
But I have a pretty impressive team.
Yeah, and just the fact that, because even when we have people from Daya and they talk about patients with abuse, right?
Yes.
So just that language barrier, that helps a lot, right?
Yeah.
So y'all have different people who speak different languages. That helps bridge the gap as well.
Yeah.
And make the patient feel
Yes.
comfortable to talk, right?
Exactly.
Amazing. Okay, so what is a common misconception about healthcare in undeserved community? Or underdeserved, sorry. Underserved.
I think like Mahtab mentioned that people think because it's not like a private clinic that it's not qualified. But actually there's more qualifications, like the nurse practitioners, the therapists are all qualified, the community health workers are all licensed, even the volunteers go through a set of trainings.
Okay.
And they're very well versed in what it takes to screen a patient or like transition into the collaborative care model as well.
So the volunteers are trained as well?
Yes.
Actually, Sonia, she leads that.
Okay.
I sign off on the hours, but Sonia has actually developed the curriculum.
Oh, okay.
For what like a volunteer at a Messina should have knowledge. Before they talk to a patient with any kind of mental health challenges. So actually tell them about what you require.
So there's an application process. We require their resume. There's a HIPAA training. There's the human trafficking training, child abuse. just what is the mental health training looking out for? What do you do if a patient has a high score? How do you input the numbers into the EHR, which is the system that we use?
Okay.
How do you log something in? And if we're not there, then what can you do?
Yeah.
And they actually help a lot with our data. They come with us to the events.
Oh.
They're basically my right hand. If I'm Mahtab's right hand,
Yeah.
the volunteers and interns are my right hand.
Oh, that's nice. You give them a chance too
Yes.
to be a part of the
Yes.
community.
And
right?
what I love, actually, your master's is in the, I always,
College student development.
Your
yeah.
master's is in that? Wow.
So that's what it's been so helpful to attract a lot of like UT, A&M. Like we attract so many like top-notch students, especially during the summer months, and then again in the winter break. And they love working with her, with the team, and we've been able to do so many workshops, and you know, our library of like mental health topics is ridiculous. I mean, I can literally just grab and go, like give a presentation thanks to her and all the efforts
Of the volunteer.
and then meanwhile they get to decide, like, you know, they really get that feel of what it's like to be in the field, because a lot of times they're undecided.
Yes.
And it's fun too, writing
Yes.
recommendation letters.
Yeah.
We got so many people in med school
Yes.
and graduate programs. So
Yeah.
that's the huge perk of the job.
Oh wow, that's amazing. You get to meet like college students with
Yes.
different personalities just willing to help. That's great. How do you exercise self-care while working?
I love self-care. I'm all for it. Definitely taking the time to reset. I will spend time with my best friend, her little one. I'll go reading, take rest at home. Pedicures are always a good option. And just really taking the time to reset, because there might be a day where we might have high scores, but it wasn't as intense. And there will be other days where we could have back-to-back suicidal ideation patients, back-to-back high scores. So even for a community health worker, just like a therapist, you do want to take that time to reset.
Yeah.
You're doing a lot of empathy, active listening, and you want to reduce that barrier and the stigmas for them and get the patient the help they need at the end of the day.
Absolutely. But you need to be in your best
Yes.
mental health
Yes.
for that, right?
Sometimes, you know, with Sonia, she just takes more classes.
Yes.
She's always,
Right now I'm doing career coaching, so that's always a good interest too.
Okay, that's interesting. So you're coaching other people, or
I'm learning about
you're
it right
learning
now.
Oh wow. Okay, so you're gonna be a career coach.
Hopefully.
Yes. Okay.
I'm like, you might as well be like certified, because she does it all day long.
Yeah.
and
Yeah.
she,
Because
you know,
with so many interns.
we've
right?
had, like I said, at least 30 interns
Yes.
and volunteers.
Yes.
And she has just been amazing at helping them stay engaged, scheduling them, like.
Yeah,
again,
that takes a lot of work, right? And also to deal with the generation is different.
Yes.
So you have to have a complete different mindset.
Yeah.
You know, so that is a whole nother thing, right?
And my coworker Hannah is a big blessing as well.
Okay.
She always supports and helps us where needed as well.
Oh wow, that's nice.
Yeah, they have a very
Good.
good energy, and I think the patients. I'm so happy that those are the first faces they see.
See, yeah. What is a common myth about community health clinics?
I think for it's just, you know, sometimes we feel like it's a substandard, but it's not so much that. It's more about, you know, what the community needs.
Okay.
And, you know, I think in my mind, the biggest misconception is, oh my gosh, it's for people who just are in dire need, they're desperate. But our model of community health care is more based on building relationships within our community, whether it's the faith community, whether it's, we're like Harris Health, like we have a lot of relationships.
Okay.
So our model is that we are part of a greater system.
Okay.
So walking in, even if we can't help you, we know who can.
Okay.
So it's this idea of like, we're not just kind of in a silo.
Yeah.
We're part of a much bigger system.
Right.
And then the cultural piece is really, I think, a positive aspect of at least our model too.
Yeah. Yeah.
And even for folks who are, working for us, a lot of our doctors are very senior doctors, and they've had a 30, 40-year career.
Yeah.
So they are part of the community.
Right.
And then they're giving us part of their talents and their gifts. And so I think it's a very, maybe like an older model of medicine where people, they were like, there's one doctor in the village and they knew about everybody.
Right.
And we just kind of took that, and except we added HIPAA to it, so you don't have to worry.
Yeah, the regulations of
because the
where
other
you
day
live,
it was
right?
one of my friends. They don't have to come to amnesty. They actually drove an hour to come see Umar, actually.
Yeah.
And then the dad's like, so what do you think? What's his impression of my son? And I'm like, I can't tell you. And then I'm like locked out of Umar's notes.
Right.
So,
Yes.
why don't you ask your son?
That'll be the best route to go.
Yeah, so that's kind of and people, they think, I go to a community, everyone's gonna know my business.
No.
And that's not true.
Yeah.
That's just not true.
Yeah. Okay, that's very interesting. And what is the role of community health worker in helping patients with mental health?
To reduce the barrier, you want to be able to speak for the patient. You want to advocate. I might have a patient like they really can't afford that $59 fee for the psychiatrist, but I will like ask our manager, or I'll ask Mahtab if we can do something to reduce that fee.
Okay.
Or if there is one of the programs going on there, we can add that to there and get them the help they need.
Okay.
And if we have any other resources, of course, use those too.
Yeah.
But you don't want to let them go knowing we didn't try anything for them.
Yeah.
The nurse practitioners, they're all very supportive. The therapists, they always come, speak to the patients, get the transition of care.
Okay. So y'all make sure that the patient is well taken care of, not just the health side, but not the physical health side, but the mental.
Yeah, I mean, they educate the patient, but I think they also, in our model, they're also case managers.
Okay.
So that, if what we have here doesn't serve you, let me figure out. And sometimes that's transportation. Sometimes maybe someone's at risk of being homeless. So the community health worker will kind of alarm all of us. Hey, this patient, this is more than just a thyroid checkup.
Yeah.
They're here, they're upset, they're very anxious. Yes, maybe we can qualify them for our medication program.
Yeah.
So that at least that's one less thing they pay for. Or let's see if we can get an Uber for them. That's why they missed 5 appointments. They just can't get here.
Wow.
So it's kind of looking at the patient more of what is their struggle within the system that they live in.
Yeah.
And they are their advocate.
Yeah. So it's like a whole holistic structure,
Yes,
right?
and patient-centered.
Yeah.
So then she has the access to that patient's doctor, say, look, they're not compliant with medicine because they couldn't afford it.
Right.
So that helps, obviously the providers to look at things from a different angle and be more compassionate and, engaged in the problem solving and trying to find solutions for patients.
Like our psychiatrist has a full schedule, and there will be a patient who's like, no, but it's an emergency. And she already has 11 patients.
Yeah.
So then we turn to the medical assistant. We're like, can we please just add her?
Yeah.
Or we'll come talk to the doctor directly. We're like, look, so-and-so is really asking for you today.
Okay.
But the providers always are very helpful, and they say yes, and we get them the help they need.
Yeah. So, but you're the front runner for that.
And that's why I think I can never say enough that relationship building.
Mm-hmm.
If I call my doctor's office, I'll just get a straight no. Our policy is XY, and it's a no.
That's I agree,
Yeah,
absolutely.
but we will go out of our way to make sure it's a version of yes that everyone can live with. That I can go home and feel like, I didn't get into this career not to help people.
Yeah.
And she can go home feeling like she did everything she could.
can.
Yes.
But I feel like it takes a whole nother personality to deal with it. Like you said, the empathy comes in, right? Because if you see that patient, you're not making judgments. You are actually there to help.
Yes.
So I think that's really different, especially in the community that we live, right? The culture we live in, it's all about me, right?
Mm-hmm.
So like this is different. It is community centered, and like you said, patient centered. You're there just to help them in any way you can. So kudos.
Yeah.
Yeah.
It's a great model. I think that's how we also heal in communities.
Okay.
Sometimes we have a mental health breakdown because we don't have that sense of belonging, and then multiply that by you leave your country. Maybe you left your country by force. Maybe you had to leave everything so last minute.
Yeah.
Maybe on your way out you lost half your family. So this empathetic model and there's I also feel like we're a little bit kind of like ambassadors because our team looks like the melting pot of Houston.
Okay.
But we're a little bit maybe further in the journey. Like, Sonia can speak perfect English, obviously. She's educated here. Or, so we have that familiarity, but then we also are confident and competent to carry folks over these life hurdles as they face the new challenges of like a whole new life.
Absolutely. What advice would you have for those who want to work with patients with mental health challenges?
I think really having that sense of listening. It's how you also use your words. You want to say a person is living with such and such mental illness, not that I have it. So if I say so-and-so is living with schizophrenia, not so-and-so is schizophrenic, because that will help the patient see how they see themselves, not how they want others to see them.
Yeah.
And having that empathy, that understanding, like, what am I doing?
Yeah.
And at the end of the day, what did I do help somebody make a difference in their day?
Yeah.
Or how Mahtab said, like, you didn't just let it go.
Yeah, I love the point that they're living with it, because we are so quick to judge, right? Like, oh, that he's a schizo. Like,
And that's part
just
of the
their
healing.
Yeah, I mean, and I hear kids say that too in more of like they think it's a fun way just to make fun of someone, but that's not right,
And that's professionalism, and you add the empathy piece. One thing that I'm so proud of, like both our CHW team and our clinicians, it's just there's no gossip.
Yes.
Everyone is always trying to find the right answer for the patient.
Okay.
And so that being mindful, being present, and really making that time about the patient.
Right.
And then being okay, like not to know. They know that they could text me, they can call me anytime.
Yeah.
And rely on each other.
Okay.
So it also takes a lot of knowing yourself.
Yeah.
There's times where they have to be like, okay, Mahtab, I've had enough. I need a breather. So they'll come like to my office. We'll switch. Like, okay, who's got what going on?
Yes.
Yeah.
And we'll step in and we'll give our team member that relief they need so that they can show up better. Because a lot of times when you're facing other people's mental health, your mental health is also on the table. You know, and a good example is me losing my parents.
Yes,
and
absolutely.
how they've had to just dance around me and you know, almost like set the boundaries on my behalf. I didn't even have to ask for support. Like I looked and the schedule was arranged so that, you know, I can take care of myself. So these are all things most people don't have the skills. I think we can be safe to say. So I'm truly blessed that, you know, that I'm surrounded with folks who do. So.
Oh, that's amazing.
There's also you can't fill from an empty cup.
Right,
And that's as true as you get to it. You really do have to take care of yourself before you can take care of others.
I'm glad you say that. We're going to take a quick break and we'll be right back with this amazing topic. Welcome back to Chai Time on 103.5 Hum FM. We are engaged in this great topic of community health clinics. We were just Mahtab was just saying that she has her community health workers and clinicians. So can you tell us the difference between them?
So the biggest difference is how they approach patient care. So the CHW model is more about patient education and then care navigation. So they have a pretty good amount of knowledge with what to look for, kind of like the red flags of mental health or any kind of health, because community health workers are now doing specialty areas. Like you could kind of specialize in senior care, you know, behavioral health, you know, nursing. You can take your CEU classes, and I think she'll go into that a little bit later. And that would kind of give you almost like a subspecialty. So in our setting, our CHWs know a lot about the general conditions of mental health. Enough to where they could have a, 10-15 minute conversation with a patient walking in and pick up on what their needs are. So they're doing kind of a needs assessment for that patient. Now, a counselor, as you know, would have to have like a license to practice in that designated state. So whereas a community health worker in our setting, they will have like 1,000 hours, and then their courses, and then they have to, how many CEUs you have to do every year?
80. 20 hours of it.
So they have the continuing education, the 1,000 hours. Usually, like my whole team has at least a bachelor's. She has a master's and a postmaster's training. And I usually like for them to have either sociology, psychology, or I know Hannah has public health background, something in that area where they are already kind of patient-centered and curious about healthcare and stuff. And then our counselors, depending on which lane they are in. So we have 2 social workers, we've got LPC, and then we have LMFT. So social work licenses are usually you go through bachelor's degree, master's degree, then you take your exam, and then you need to be in a clinical setting for 2 years post. Passing your boards. Whereas, like in my license, we pass our board after our master's degree, and then we have to complete 3,000 hours. And then 1,500 of those 3,000 hours need to be with a couple or a family in the room. So we are a little bit more relationship centered when we are treating people. And then LPC, same thing. They go bachelor's, master's. They have to pass a board exam, and then their clock starts for the 3,000 hours. But their 3,000 hours could be any combination. They don't have that 1,500 with couples and they just need to have direct patient contact. So everyone on our team is I mean,
Makes
they
sense
look
somewhat.
very young, but they're way qualified because of the journey of what it takes to become an associate license. Even as an associate license, I know in my program, after the first year in graduate school, we had to see patients on the University of Houston, like the community clinic. And so we already had patient care experience. We just had a phone in the room, and our supervisor had the one-way mirror watching us.
Oh, okay.
So, but we started seeing patients like right away.
Oh, wow.
Yeah, and that's kind of that's the model.
Yeah.
And then we have 4 psychiatrists on our team. Obviously, they went to med school, and then they did the residency. And Dr. Din, she's a child and adolescent psychiatrist. Dr. Bagri has specialized in geriatrics and addiction. So sometimes you do those residency programs, and then for the subspecialty, it varies by school, but it's still at that point you're more than qualified to treat any kind of
and you have so many different specialities, right? From kids to seniors, so that's great.
We're actually very excited. We're waiting for the credentialing process. We're getting a provider who has extensive background in pediatric neurology and has done a lot of good work with like the autism spectrum. So it's just kind of sometimes these credentialing processes take time. But we'll make that announcement later. But that's the difference. One is more education, patient empowerment, care navigation, and then the behavioral health clinicians are more about diagnostics and treatment, and then the medical behavioral team is more like, okay, all this stuff, and then you need medication. They're more like the medical model.
Okay, that's amazing. So can you share with us one story of how this role has made you step out of your comfort zone?
Yes. Talking more.
All right.
We're talking to patients all day long. We're talking to the nurse practitioners, to the therapist, to the psychiatrist, the administration and leadership team. We tell Mahtab about all of this. So we had a patient. She comes every week to see our therapist. She comes twice a week. She lost her husband. And in the beginning, it was very hard for her to open up, come. And now every other day when she's there, she's like, "Hi, Sonia. Hi, Hannah." And we're like, "Hi, how are you doing?" And she'll openly like talk to us, feel more comfortable. She recently actually brought edible arrangements for our team just as a thank you. Because she's been with us for a while, but she actually, like, from when we first saw her to now, we're happy that like she's doing better. Slowly but surely she is feeling better. And at the end of the day, when she's leaving, we do like tell her, have a good week, like take care of yourself. And somewhere down the line, I know she appreciates that. That there are other people who do check in with her. Even if she's just coming to say, "Hi, I'm here for my appointment." But did you take out a few minutes of your day to actually check in with them?
Oh, wow. That's
a
great,
true
right?
Yeah. Because we are, I think for a lot of our patients, we are a second family.
I mean, and that is just amazing to hear, because I'm just comparing my experience when I go to a doctor's office, and they're just like, "Oh, hi, that's it," or "You need to fill out your forms," and that's all, right? There's no further conversation happening. So this is so much more, and I wish more people could do that, right? Because y'all are taking care of so many different aspects.
And I guess a more realistic version of it also would be just during the screening process. A lot of these patients will start crying. When you get to the depression or anxiety question, their tears will start, and I'll go outside, get them a tissue and water bottle. But then they will slowly start to say, like, "No, this is what's bothering me." Even if you did just come in for a regular medical checkup, some of these questions could actually trigger it.
But
And
you
then
taking
wanna
that
get
small thing, like getting a tissue, I think
Yes.
just like you said, that act makes it special for them, right? And especially you said the different backgrounds that they come from. So
Yes.
the act of caring, I think, makes them
Yes.
open up. So amazing, you know.
Yeah, they're very good about that. Like,
Yeah.
I've had some people say, "Can I just keep talking to Sonia?" Like, well,
Especially when it's in Urdu. Or for Hannah, it's in Spanish. It'll just be
'cause
on
they're
and
so
on.
much more comfortable, right?
you know, that's actually in Texas, I believe it's Medicaid that is going to like reimburse for CHWs doing patient education.
Oh,
And that was another reason I told Sonia, I said, you should do some like health coaching or career, because people do like to open up to her.
Yeah.
And
She has that
the mental
gift.
health
Yeah,
background.
yeah. She's multi-talented. That's
Thank you.
amazing.
It's so good to have that.
Right?
Honestly, at the end of the day, it's who you have in your corner. Like for us, we have Mahtab, we have our manager, so they're both very supportive.
Yeah.
And without the medical assistance and Hannah, like I really wouldn't know what to do. Without the volunteers, I really wouldn't know what to do at the end of the day either.
Yeah. Oh, okay. See, that takes a true person to give credit to everybody else, right? So what patterns do you see in the patients who visit the Ibn Sina clinic?
I would say not being compliant with medicine, lack of transportation, lack of funds, accessibility. Somebody, they've really just said, I really can't afford my diabetes medication. So how do I come
Yeah.
to pay that fee and then still have to go pay for your diabetes medication, get the insulin if you need it?
Yeah.
That's a very hard challenge.
For them.
And it's a realistic challenge.
Yeah.
So anything that the clinic can do to lessen that
Yeah.
burden, that we want to do that.
Yeah, you'll try to help with that. You know, like you said, you'll try to arrange Ubers because they can't
Yes.
even, come. So that's great.
I also think, for the population that we serve, if you were to like align all the different mental health diagnoses, I think anxiety would win, just because that there's so much life transition, and oftentimes the uncertainties that are tied into financial difficulties and being in a country you don't know your way,
Yeah.
and not having your family. These
Yeah.
are like multiple factors that really bring people down. So I think even as a community, like when people say, well, I hear your stories, but what could I do? And my thing is, go sponsor a kid for like 5 sessions,
Oh.
or come volunteer your time if you have a skill. If you're a nurse but you're a stay-home mom, come teach a class in your native language. Like there's so much to do in that platform of a community health clinic, that we can really get everybody to buy into all the good that we can make happen together. Because there's a lot of changes too, as like nonprofits are losing funding, people that are not living in the community that used to make, good decisions for the greater good are no longer there.
Yeah.
So I think the model of a community clinic is going to be a revived concept, because we wouldn't have any other way of doing this.
Right.
So we really need to come together
As a
Yes.
community.
As
So on that line, like where would they go to the website, Ibn Sina website? Like if you said like someone wanted to donate for 5 sessions or volunteer, like there is a
you can donate. You can donate by department.
Okay.
You can say, I think I want, like I've done this with just my office is in the middle of the children's clinic, and I hear, a family and they have 5 kids, they can't afford, and I'm just like, this one's on me, bring some good to my kids' lives,
right.
But I mean, when you're in it and, or these kids are walking in and one has shoes on, the rest don't, everybody's mismatched, and you're like, oh my God, this is this is America. Whereas, I'm telling my kids,
Yeah.
get your shoes out of my way. I'm tripping over your shoes.
Yeah.
So somehow we need to connect
There's
these,
that gap.
the gaps with the resources.
Yeah.
Right.
Because we're very privileged.
We are, I
think
agree.
as, second and third generation immigrants, and to truly foster empathy. And empathy is a very selfish thing, by the way. If you cultivate empathy in yourself, in your family, you actually build up immunity for depression, anxiety, and substance use. That's the ironic part, that empathy is a selfish thing.
Yeah.
But we are lacking, I think, a lot of times the actionables.
Okay.
What we do to show up for
Yeah.
each other, to show up for our own community. And our context is very unique because it's just about a healthier way of being. It's not that you're purple or black or this color or this religion.
Yeah.
We want everybody's kids to be healthy and go to the doctor less. So we have everything invested in making folks healthier, because we know if we don't help this group of people, we all pay for it.
Yes. Absolutely.
Right? So we're very much in that preventative model.
Yeah.
But also like the humanistic model.
Yeah. Yes.
That we all go through pain. Everyone hurts when someone dies. The other day I had a woman from Afghanistan who lost her baby. And it was because of a screening these guys did. Mm-hmm. And then she spoke Dari. So then I was like, well, that's got to be me.
Yeah.
By default. And I started talking to her, and I'm like, oh my, as we're unpacking, it's not just she lost her baby. She's 37. In the world that she comes from, she's already an old lady.
Oh.
Instead of the guy being nice to her that she's going through a miscarriage, he's yelling at her and threatening her. And so now she's like, am I going to be homeless? And then he's considering maybe a replacement wife, a much younger one. Who, I mean, kind of, you talk about stories, and then I'm sitting here like, this one took a turn.
Yeah.
And it all started with Sonia caring enough to say, how are you really doing?
Yeah.
Right? She just came for spotting.
Oh my.
But it turned into a whole.
Yeah.
So now
There's
she's
so many
coming
layers.
again. I'm like, you come, even if if I have to see you on my lunch hour and we wave your feet, just, you can watch me have chai and but I'm not gonna abandon you during this time of your life.
Yeah.
Because she would be a high risk suicide. I mean, she had no one.
Oh my goodness.
Think about it.
Like,
and
she has no family.
6 years of age, mom dies.
Oh my.
8 years of age, dad dies.
Oh my.
And then she and her sister had just been passed around to uncles and aunts, and then apparently just married off to the the greatest pick of the batch. So I mean,
and then she moves here.
Then she moves here.
Oh my Lord. Yeah.
Yeah. So I mean, the stories are not just I'm having a rough day.
Yeah.
It's a lot to unpack.
Yeah.
And it does. So whenever Sonia's like, can I have it? Can I take a half day or go? I'm like, I know what she deals with because sometimes
she deals in the bigger sense.
Yeah, and I think that's why every director, everybody in leadership, you should always have a pulse of what your team is dealing with.
Right.
Because it's not an easy conversation to go in and actively listen, and someone is telling you they want to die, they wish a car had just hit them. And then you have to put that person together and figure out who they should go, what they should do next, and then make sure they're gonna get home safely. So yeah, if she needs a break, and I truly know what that workflow looks like, then I would be insane not to do something about it.
Yeah.
And it's a very rewarding, but it's a very heavy job.
Yeah, just
on all
listening to
fronts.
it, like I can start crying.
No,
Like
yeah.
y'all deal with it day in and out, you know.
Yeah.
And there are
So-
times where we had a patient, it was an active suicide. They had cuts, they were bleeding actually down their arms. Their sibling brought them, and it's closing time.
Yeah.
So it's 4:30. It's like,
Yeah.
okay, yes, they're actively suicidal. The screening is high, everything. But even at that time, Mahtab still came over. She came, got them the help they needed, worked with the nurse practitioner.
Yeah.
And there were a lot of follow-ups to this, but did we get that patient the help they needed?
Yeah.
At the end of the day, yes.
you saved
And
their
even
life.
if it's closing time, like
Yeah.
the whole staff is very supportive towards this.
Oh wow, that's
Yeah.
amazing.
We have really, really good people.
That is great. What are your thoughts about stigma in mental health?
To end it,
Yes, that would be the dream,
mental
right?
health does not discriminate, unfortunately. It affects every race, ethnicity, age group, gender, and life doesn't stop for anyone.
That is so true.
So having that self-awareness, being a supportive, caring person, those are really things that will make the difference in the community. I know the community I come from, people will in conversation just talk to me about issues, and I will, out of not judging them, tell them, hey, turn to so and so, we have this person at the clinic, you know, you could come see, or here's a resource, do this for self-care. Even something as I'm not sleeping, here are some tips for sleep hygiene.
Oh, sleep hygiene. That's a new concept. I've not heard of it.
So I think the best way to tackle stigma is to practice what you preach. You know,
Right.
I'm very big on that, because you can it's like going to hire a personal trainer and they don't look like they're doing much training.
Yeah.
You just cannot sell it. But if you truly show up in your authentic voice, and when you're struggling, you say what you're struggling with, and you go do something about it.
Yeah.
I think that would, over time, that's going to help normalize, because a lot of young kids right now are suffering. Like, some kids will come to our clinics and say, I need it, I want it, but my mom will not let
Yes.
me.
Oh, okay.
So then there's been, actually, we've gotten some
We've had
volunteers out of the conversation, because they're like, we just want to be around you guys then.
Oh,
And so they sign up to volunteer.
Yeah.
and they end up not only overcoming their anxiety or whatever the life pressures they were dealing with, but I mean, figuring out the next phase of their life with so much clarity, just so that, because they had that safe space.
Yeah.
So that as parents, let's not judge each other.
Yeah, yes.
If our kid is struggling, get them the help
they
and
need.
get them the help in a timely manner,
Yeah.
because that makes all the difference.
Right. That's the big lesson. What have you learned from leading the data team for a pilot project? Lessons and wisdom.
Having good communication, having a good support system, and good leadership skills. I think with the RICE leadership program also, and the project at the same time, it was a lot of, okay, Mahtab is, doing this, our manager's doing this, our coordinator was also in her part of leadership, and then you have me, who's leading the volunteers and interns, but then also working with the medical assistants and training them how to do, like, what a screening looks like, and practicing that. So also celebrating the small wins.
Right.
For us, even if we got like 3 high scores, okay, you helped those 3 people, but that also made a small step towards the project goal.
Okay.
And we
Yeah.
succeeded.
Yeah.
So every time Sonia comes to my office and she starts talking, she's right. I asked her to do the RICE leadership in the worst time, because we were in the middle of a very big project, and I'm like, I promise you, the pain points we have and your desire to learn, she always wants to learn. And the stress, I'm like, don't even call it stress. It's you stress.
Yeah.
and then you'll have something to show for it. So she did that the 1 year. It's a 9 months,
And a
and
big
then
credit
she got
that goes to
certified.
Mahtab.
Yeah.
We're very grateful for that.
That's awesome.
And then pivoting, being flexible, because sometimes the grantor will give you new guidelines, they'll change stuff, and you have to adapt your workflow, which, like she said, you need to have good leadership, good communication, and getting everyone's buy-in to the new processes and procedures.
That is amazing. Kudos. So thank you for being here. It's almost the end of the show. Do you all want to share any wisdom with us right before we end? What is one thing you would want to share for listeners out there?
Take time out for yourself. If you have self-awareness, that's good. It'll help you, your loved ones in the long run. And anytime we can do anything to help you, please let us know.
Okay, awesome. All right.
Same. I think I've sent my family and my friends to Messina, and I really appreciate
And that says a lot,
it.
right? That's how much you trust. I think when you send your family to anywhere, then you know they're in good hands, right? So that's amazing. All right.
Thank you.
Thank you so much, listeners, and thank you, Mahtab and Sonia, for being here. This was a very enlightening conversation.
Thank you so
thank
much.
you, and we'll see you next time, same place and same time. Bye bye.